discussion about the health crisis that is looming here in the country, and we're having this conversation with the Kenya Union of Clinical Officers Secretary General George Gibore. We were also, when we started the interview, we had Clifford Randa, the organizing secretary of the Kenya National Union of Medical Laboratory Officers. But due to matters technology during this time of COVID-19, when we're trying to have a conversation via Zoom, anything can happen. So I do apologize, you're not able to continue having Clifford Randa due to that technical hitch that he's experiencing on his side. But once you get a hold of him, of course, during this discussion or a day later, or probably tomorrow or any other day, we will be talking to him about that strike that he says is actually confirmed. It officially kicked off today. So all the laboratory officers are on strike here in the country in public health facilities. It is a developing story. We wait and see what the government will do. But then, for the clinical officers, it is a matter of, it's a game of cat and mouse, because on one hand, the national government comes and signs an agreement. On the other hand, Council of Governors come and say, you know, we were not involved. You cannot attain this because it was not in the budget. What is the way forward? So now, let me continue having this conversation with the Secretary General, George Gibore. And thank you so much, Mr. Gibore, for keeping, for staying with us here on KTN News Center. So now, it looks like it's a match. Actually, it's not even like it looks like, but it is a cat and mouse game between you and the county bosses. So now that they have decided to say we were not involved in this, how sure are you that the actualization of your 2017 collective bargaining agreement will be finalized by next month? That's February.
Okay, thank you very much, Brenda. And in negotiation and conciliation, this is where goodwill must be able to count. And of course, as you have said, they have, for us, we treat this as being insincere, and we want to tell Kenyans that we have demonstrated our goodwill by ensuring that we have been able to agree to a number of issues, despite the counties and the employer having not met all the demand that we had requested. But we created a pathway to engage and discuss so that we can be able to resolve all the issues. As you'll see, around this, since we started the strike, about 17 counties have gone to court to seek orders to actually compel the healthcare workers, that's the clinical officers, to go back to work. But the court has been asking, most of the question, the common question that they have been asked is, can you prove that you have provided comprehensive cover for the clinical officers? And none of them have been able to actually provide this. And indeed, this is what we have been discussing on the table, that the multi-agency team can continue negotiating so that we can be able to look at what they are saying that they have provided, because most of our people and none of the clinical officers have been able to benefit from what they are saying they have provided for comprehensive medical cover. I think they are making things now so difficult, and the clinical officers need to rethink their goodwill, and that is what they are doing. And I think once they have taken away their goodwill, we can only do them service to take away our goodwill. And if they still wish, they still have time to actually ensure that they fully sign the return to work and ensure that clinical officers can be there at their area of work as we deliberate to ensure that we can be able to realize and implement the return to work that we have been able to sign. And this is not an overnight thing, as the Council of Governors want to put it. We have clearly provided pathway on how this will be able to be implemented from time to time. And the issues of money, where they are begging money, I think the governors have their own issues, and that's where I feel that they are feeling that they need maybe to change their mind because of bringing other people who are not on the table. Right. And I need to say, when you are negotiating, like Kenya negotiating with another country like Tanzania, you do not discuss issues of Somali. You do not discuss issues of Uganda. You only discuss about the people who are on the table, because they have brought substantive issue where even the head of state have been able to acknowledge that the issues raised by healthcare workers are tangible and realistic, that the government need to listen to.
All right. So talking about the goodwill, and doctors had the goodwill. They had a roundtable meeting, sitting with the government, talked and decided to call off the strike. But in Mombasa, things look like it's going to be a bit rough for the doctors because they've been given a show cause letter. And Tobias Shanji is back again with the doctors, and they're going to be telling us why they've been given the show cause letter by Mombasa County government. Tobias Shanji, good morning. So kindly talk to us about the show cause letter.